In this video, we're going to demonstrate the 90-degree drop arm test or the 90-degree push arm test to indicate a supraspinatus rupture or serious tear in the supraspinatus. So we passively support the arm so that there's no pressure on the patient's arm, because this may be extremely painful for them. We passively abduct the arm to 90 degrees. We encourage the patient to know that if we reduce our hands away, that our hands are directly below their arm in the event of a fail, and we're here to catch their arm. So what we simply do for the drop arm test is to leave their arm in this position, and then on the count of 3, I'm going to release my hands, try and hold your arm in this position. So a pass on this test would be if the patient can hold their arm. So if I reduce my hands and the patient can hold. Now, if it's a case that if I take my hands away, a positive finding on this test would be if I take my hands away, the patient is unable to hold their arm at 90 degrees and the arm with pain or without, if I take my hands away, the patient's arm would collapse and drop. We would also make sure that if this happens, we just reduce our hands below in the event of, so that when we take our hands away, we can catch the patient's arm in the event of a drop to reduce any further injury. If they're indicating some pain but are able to hold, we could then addition to this, and when the arm is in a hold position, we could place one hand below if required. The patient should be able to hold their arm, and then what we can do is apply down pressure to the arm, and again see if we elicit pain and or a collapse of the arm. If we have a positive finding on this test, this would indicate a more aggressive tear or possibly an avulsion to the supraspinatus muscle itself. We hope you enjoyed the test, guys, so thanks for watching.